Assalamualaikum. Welcoming all of you into my presentation. Today I am going to talk about the heart, especially the some of the morphologies of the heart. That is the anatomical position, the surfaces, borders, and the different chambers of the heart. Then I will try to talk about the artery supply and the venous drainage of the heart. So let's start with the heart. This is the heart that is situated in the middle mediastinum. We all know this is situated in the middle mediastinum, and this heart is actually will have the apex, the conical, and this is directed like this, downward, forward, and to the left. The base is on the opposite side, as you can see. This is the base here. That is this quadrilateral shape or quadrangular shape. It is directed just opposite to the apex of the heart. That is upward, backward, and to the right. And then the anatomical position. This is the sternocostal surface. This one is the sternocostal surface because this is just below the or posterior to the sternum and the ribs and cartilage, so it is known as the sternocostal surface, and this is directed like this, so upward and forward. And lastly, we have the diaphragmatic surface, which is flat and directed downward. So these are the anatomical position of the heart. The location and the anatomical position we'll focus on. Next, I'm going to talk about the different chambers. I'm not going to focus about the surfaces and borders of the heart. I know you know it. So let's see the chambers of the heart. And we all know the chambers of the heart. We have 4 chambers, the 2 ventricles and 2 atria. This is the part of the heart, the main bulky part of the heart. We call this the ventricle. And the remaining part, the behind, which is situated not in front, behind the heart, and this is the part we call this the atria. The auricle is also there in front, but this is the main part that is known as the atria. And so at first in the embryonic life, the heart was actually like this, a straight tube-like structure. If you can divide it into 2 parts, the upper part will form the ventricles and the lower part will form the atria. So how it will convert into a rounded shape. Our heart is a rounded shape, we know. So heart will have to look like this is the ventricle, this is the atria, and we know the main bulkiest part of the heart is the ventricle. So the atria, the lower part, ultimately will look like this and will go behind the ventricle and the upper part of the heart. So it will look, this is the part now, the atria, and this is the most of the part is forming here. It is the ventricle or the belly of the heart. So as you can see in this model, this is the ventricle, this is like this, and the atria, it has looped and ultimately it has come into the posterior superior part of the heart. So this is the atria. So now let's focus on the blood supply of the heart. The blood supply, that does mean the artery supply and the venous drainage. Let's start with the artery supply. But before that, let's see the major vessels of the heart. From which chamber? We know that this is the right ventricle here, and from the right ventricle a tube is coming out, and this is known as the pulmonary trunk, which is going to the lung. And from the left ventricle, another tube is coming. This is called the aorta. So we'll focus on the aorta because it is containing the oxygenated blood. And let's see from where the aorta is actually coming out. Aorta is actually coming out. Let's remove this part of the ventricle and let's see the inside of the heart. So this is the this is the left ventricle here. This is the chamber of the left ventricle. The upper part, this is the left atria, inside of the left atria and left ventricle. And from the left ventricle, here I put my finger there, and from where the aorta is coming out. We already know this is the part we call this the ascending aorta that is coming up. So that is the ascending aorta, and there will be the arch. This is the arch of aorta, and the arch will go behind into the posterior mediastinum. This is the descending aorta. Actually, these are the things that are carrying the oxygenated blood to almost the whole body of towards our whole body, right? So ascending aorta, arch of aorta, and descending aorta. Ascending aorta, as it is within the heart, it is located in the middle mediastinum. The arch of aorta is above the heart, so it is located in the superior mediastinum, and the descending aorta will go behind the heart, and ultimately it will locate in the posterior mediastinum. So let's see the branches of these three major branches. Major branches, that is the supplying areas. We'll focus on one aorta for the blood supply of the heart, the ascending aorta. But let's talk about the arch of aorta. What is the role of the arch of aorta? The role of the arch of aorta to keep the nutrition to the upper half of the body. That does mean the upper half of the body, your head, neck, your brain, your eyeball, and the upper limb, and the thoracic wall, anterior and posterior thoracic wall. The posterior thoracic wall actually is supplied by the descending aorta, but this almost the whole part of the upper half of the body is actually supplied by the arch of aorta. What is the supplying area of the descending aorta? Descending aorta actually will supply the posterior part of the thorax, but its main contribution is to go through the diaphragm to supply the abdomen, that is abdominal viscera, and all these things, and ultimately will go to the lower limb to supply the lower limb areas. So descending aorta is actually supplying the posterior part of the thorax, the abdomen, and the lower limb. Arch of aorta is supplying the upper, the thorax, upper limb, head, neck, brain, and eyeball. So heart will ask, I am doing all this works, where is my oxygen? From where I will get my oxygenated blood? So there is the ascending aorta. So let's talk about the ascending aorta. This is the ascending aorta from the left ventricle. The left ventricle is carrying the oxygenated blood, and ultimately this oxygenated blood will be pumped into the whole body. So the first blood will go into the ascending aorta. Let's think this is the ascending aorta. Let's think this is the ascending aorta, and this is arch, and this is descending. So ascending aorta, inside the ascending aorta, you feel inside the ascending aorta there will be three pocket-like structures, three pockets inside. So when the blood will pass through the ascending aorta, blood will be accumulated in these three pockets. So these three pockets are space. Space in anatomy we use it the term sinus. So space, that is the sinus in the aorta. So we call it aortic sinus. And these three aortic sinus, if you can see, this is the left ventricle, and this is the mouth of the ascending aorta, and in the mouth of the ascending aorta within the wall there are three pockets here, three white-like things here, and we call this the aortic sinuses. So these aortic sinus will collect the blood, one anteriorly and two posteriorly. So this is known as the anterior aortic sinus. These two are posterior aortic sinuses, one on the right side, one on the left side. So these three will collect the oxygenated blood from the ascending aorta, and from the anterior aortic sinus a tube will come out, and this is known as the right coronary artery. From the left side of the posterior aortic sinus another tube will come out, that is known as the left coronary artery. So again, the heart is actually supplied by two coronary arteries, the right coronary artery and the left coronary artery. They are coming from the ascending aorta, and from where in the ascending aorta. Because ascending aorta, the blood is flowing through it. But ascending aorta, inside there will be pocket will be there. We call this aortic sinuses. So more specifically, you know, right coronary artery is coming from the anterior pocket or anterior aortic sinus of the ascending aorta, and left coronary artery is coming from the posterior, left posterior aortic sinus of the ascending aorta. Now let's see if we can follow this from the, you know, aortic sinus. Let's follow the right coronary artery first. Right coronary artery. Right coronary artery, I'm coming from the ascending aorta, anterior aortic sinus, and then I'm coming over the surface of the heart here. In the surface of the heart, between the, you know, right auricle and the infundibulum of the heart. Infundibulum, that is, you know, the bulbous part of the right ventricle. So between these two, the right coronary, you can see this is the right coronary artery here, the reddish one. The right coronary artery will emerge on the surface of the heart, and ultimately this right coronary artery, now it will say that I will cover the right part of the heart. The left coronary artery, which will come from here, the posterior side, and ultimately, okay, I am going to supply this area of the heart. So these two parts are supplied by the, vaguely we can say that the right heart is supplied by the right coronary, left heart is by the left coronary. Now let's hold this. This is the right heart, and this is the left heart. Okay, fine. So right coronary artery, I am just you know, concealing the left heart because this is by the left coronary artery. So you see this one, the right coronary artery, again it is coming from the anterior aortic sinus of the ascending aorta. This is the first point. Then what will happen? Then, okay, fine, I am going between this group, and between the auricle and the infundibulum, I am passing through, and suddenly I found that I have to give supply to this area. This is the cone area, you know, this is the cone-like area or the infundibulum. So I have to supply the infundibular area. But as it is cone shape, this artery is known as the conus artery. So fine, I am going to supply the conus infundibulum as conus artery. I am going to supply the ventricle here, right ventricle. So ventricular rami, that does mean branch, you know, the ventral rami, dorsal rami. So that doesn't, so ventricular branch or ventricular rami. Well, I am going to supply, behind to supply the right atrium also, the atrial rami, and in the above of the right atrium, I will find a SA node here. You know, the SA node, the special cardiac myocytes are there. So I supply the SA. So this is known as the nodal branch. Again, let's see. The conus branch in the infundibulum, the ventricular rami, then the atrial rami, and then from the atrial rami, a branch will go to supply the SA node also, the nodal branch. Then what I will do? I'll continue. I'll find a margin here or the inferior border of the heart. I'll give a branch here along this branch. So this is known as the marginal branch. Then I will go behind, and I will find a groove here. And this is, you know, the posterior interventricular groove. This is the interventricular, anterior and posterior. So I will give a branch to the posterior interventricular groove, from where the septal branch will come through this and will supply the ventricular septum, interventricular septum. So this is the thing, and then I will proceed forward, and here I will wait at the crux of the heart. That is, this is the crux of the heart, and where I will wait to meet with my companion, that is the left coronary artery. Where is the left coronary artery? Then again, the right coronary artery. I am repeating again, you know, the right coronary artery is coming from the ascending aorta, from here of the anterior aortic sinus of the ascending aorta. I will give a branch to the hair cone or infundibulum, conus branch, ventricular branch, atrial branch, SA nodal branch, the marginal branch, and I'll go behind here also ventricular branch, and the posterior interventricular branch. So these are the branches of the right coronary arteries. And left coronary artery, the left coronary artery, again, this is the right coronary artery between the infundibulum and the right auricle. So between the infundibulum and left auricle, the left coronary artery will come. Will come from where? Will come from the ascending aorta. From which part of the ascending aorta? From where? The posterior aortic sinus. On the right side or left side? Left side. So left posterior aortic sinus, the left coronary artery will emerge between these two. And suddenly, when it is emerging, it will find there is the groove here. The right coronary artery has found that groove in the posterior side after going so many, after giving so many branches. But the left coronary artery will find this groove at first. So it will run first to the groove. This is the continuation of the left coronary artery. So left coronary artery will give a branch here. What should be the name? We know anterior interventricular branch. So anterior interventricular branch, this is the anterior interventricular branch. If I place it in anatomical position, this is the anterior interventricular branch. This is the branch of the left coronary artery. The posterior interventricular branch, it is the branch of the right coronary artery. So anterior interventricular branch will supply the anterior superior. If there is the septum inside, the septum should get supply from the left coronary artery, that is anterior superior part, anterior superior 2/3. This is the anterior part and the superior part, 2/3 by the left coronary artery. But posterior inferior, just posterior inferior 1/3 part, it will be supplied by the right coronary artery. So interventricular branch, anterior and posterior. One from the left coronary, one from the right coronary artery. Okay, fine. The left coronary artery find, it is continued as this anterior interventricular branch, and it will give a branch like this. That will go that will go to circumflex. Circumflex means going around like this. So I will circumflex, and ultimately here in the crux of the heart, I will meet with the right coronary artery. Again, left coronary artery giving at first, this is the branch, or this is the continuation of the left coronary artery, and it will give a branch like this. In between, it will give branch to the ventricle, the ventricular rami, sometimes the conus branch, sometimes an artery will go like this, the diagonal branch, the circumflex branch, and the circumflex branch will give a branch to the marginal branch. The same as the right coronary artery, almost same, but the main two branches or continuation, it is the anterior interventricular and circumflex. This is from the left coronary artery, and they will meet here like the crux of the heart. What is the crux? Crux means cross, is a cross. Yeah. So there will be cross here. This is the posterior interventricular group. This is the posterior atrioventricular group, and this is the interatrial group or interatrial line. There will this is the thing here. So you can see this is the thing here, looks like a cross. So where the posterior interventricular group, posterior atrioventricular group or posterior coronary sulcus, and the interatrial, they are meeting. This is known as this point is known as the crux of the heart, where the main branch of main stem of the right coronary artery itself and the circumflex branch of the left coronary artery will meet. And this is going like this. You see this one, the right coronary artery is going like this, the circumflex branch is going like this, and they looks like a they look like making a crown. This is like this, the crown. Coronary means crown. Corona means crown. We already mentioned corona has nothing to do with the heart. Corona means crown. Corona radiata, the coronavirus is, crown like something. So you always have to know this thing here, the basic thing of the right coronary artery and the left coronary artery. So we'll discuss the venous drainage and the nerve supply and all these things in the subsequent classes. Hope you will stay safe, and thank you very much. Thank you.